On the day of surgery, you come to the hospital. We do minimally invasive surgery, which means a keyhole operation, small cut, about 4 or 5 on your abdomen. We put the camera in, we do the surgery, and you should be able to stay overnight and you go home the next day. This is pretty much standard throughout the country. And after the surgery, you will have some water and clear liquid diet, and we'll see how you tolerate. Sometimes having nausea, a little bit of vomiting is common. It's a part of a healing process, and soreness at the operated site. But it will go away as each day passes by. And at the end of 2 weeks, you will be back to your baseline pretty much, and doing your routine day-to-day activities with more energy and more enthusiasm. There are various stages of diet you will go through after the surgery, and you will be educated with the dietitian. First few days you will be on the liquid diet, which is just the liquids, and then slowly pureed diet and mechanical soft diet. And then finally you will be back to your regular diet. It takes about 4 weeks altogether, 4 plus or minus, or a couple of weeks here and there. And you will be back to baseline. But what is important is you will not be able to eat the same portion of food what you were eating before, because all the bariatric surgery or weight loss surgeries have a component called restrictive surgery, which means it restricts the amount of food you can eat. And on top of it, it has a hormonal component, which is very effective, particularly stomach and the gut hormones changes, which will make you feel full. Most of the times you don't feel hungry. And so it takes about 4 weeks. I think you should be back on your regular diet, but you will not be able to eat as much you were before. Every individual's perception of pain is different. So I have seen patients going back to work after 3 to 4 days or within the first week. And most of their work involved a desk job wherein they sit in front of the computer, do things. But driving, as long as you are able to turn, move around, reach the gas pedal, and you are off of any kind of pain medication and you are comfortable, you should be able to drive within a week or after at least 1 or 2 weeks. After surgery, you will be followed up in our office very regularly. You will follow up with the surgeon, dietitian, psychologist, every so often. Usually we follow up after 2 weeks after surgery, 3 months, 6 months, year, and after that every year. We check their vitamin levels at different stages throughout the follow-up. And at the same time, they will have a choice to participate in support groups wherein they will meet the patients who have had similar surgeries for so many years earlier or who are waiting to have surgeries. And there are various educational materials we provide them, information, and it is a Partners for Life, yes.